posture, how you're moving. We'll test strength, assess like how your tissue's moving, and it's not just pelvic floor, but how your abdominal tissue's moving, your hips. So, yeah, lots of different techniques, but we'll do soft tissue work, myofascial techniques, visceral work, so we can mobilize your bladder, which you knew that you could do that, but wherever the discomfort is, we'll address that.
Okay.
And I would just add to say, if anybody has ever been to physical therapy for your shoulder, there's things we do to like free up the joint. You know, you exercise, you learn what caused the trouble to begin with to prevent, and then if it hurts, you know, learning strategies as to how not to allow that to happen again, or how to better ease the situation. So it's all of that, but in a more intimate area. And so, whether it's, you know, definitely I think the biggest tools are my hands. So I may, you know, do things, and I'll just pass the pelvis around too, but most people don't realize the pelvic floor, it attaches to your hips, it attaches to your spine, your tailbone, the abdominal wall, the stomach muscles feed into that, how your foot hits the ground, all those forces travel up to the pelvis, how you're breathing above. So it really takes, like, we look at everything, and whatever is the issue. If something's tight, we want to stretch it. If it's weak, we want to strengthen. What makes us different as pelvic floor therapists, though, is our ability to work intravaginal and intrarectal, which can sound a little intimidating, but those are muscles too. And you know, if you would never go to a knee doctor and not expect them to not touch your knee.
Right.
So why, of course, it's just another part of your body, and whatever provider you see, they should be, you know, listen to you, give consent. You know, I don't do anything, sometimes I won't do an intravaginal exam, period, or maybe for a few sessions, not until the person is ready. But there's so many things that can be done in the system, and we have like tools and things to use to help you to help yourself. I hope that answers the question. And I can pass this around too if you guys just wanna take a look.
And it's great because what I'm hearing is that pelvic floor therapy is very specific to the individual and the individual's needs. So it's not just like going to the doctor and they're telling the same person, you know, like the same thing, and this is what they'll do, but it's very specific to everybody's case as well.
Yeah, and I think to add to that, we're big educators, so, you know, we try to get as much information as we can, and educate and help teach you how to do things holistically, so that you're not, you know, we try to be as least invasive as possible. And, you know, for those who are uncomfortable with internal, there's plenty that we can do external. So it's not that you have to come to a pelvic floor therapist and do internal work. There's plenty of patients, you know, whether they're teenagers or, you know, they're just not comfortable with it yet, and that's totally okay.
Yeah, absolutely.
Awesome. How can pelvic floor therapists collaborate with other healthcare providers, such as gynecologists or pain specialists, to provide comprehensive care for us individuals with Endo?
So we are big on networking. We try to have a team of providers, whether that is, like you mentioned, gynecologist or colorectal doctors, therapists, you know, anyone we want to connect with. So we know that it takes a lot to have pelvic pain. So it's usually a combination of things that create pelvic pain. So it's gonna take a team of specialists. So we definitely want to keep in communication with that and make recommendations if we think, maybe acupuncture or chiropractor or, you know, checking in with a urologist, things like that. So we definitely work as a team with other providers. So we'll reach out and network, or, you know, if we need to talk to your doctor, or you need a letter, or whatever it is that you need, we will provide that.
Yeah, and I would say the same. As I started off saying, we're more musculoskeletal experts, and so Endo impacts so many other systems. So if it's your digestive system that's impacted, connecting with the GI doctor or colorectal doctor or functional medicine, a dietitian, so having a therapist that connects with that. If it's sexual health, I can work on the physical part, but how it shows up in your relationship and having somebody to talk you through and navigate what does intimacy look like when I don't feel good? What does intimacy look like when it's uncomfortable? And just still learning how to stay connected. So I stay in my wheelhouse and then definitely connect with like other people too. So, yeah.
No, that is a great segue for the next question, as we get into sexual health and intimacy, because sexual health and intimacy can be a problem for many of us with endometriosis. It's painful, there's a lot going on. So, what does pelvic floor therapy, can pelvic floor therapy address issues related to sexual health and intimacy, with us individuals who do have endo, and what strategies do you use that can improve that sexual function?
So we have referrals. We'll connect with, a sex therapist or, a therapist that understands relationships so that you kind of have that support. I will invite the spouse or, significant other into the session so I can help educate them on what's going on. I feel that the education part is huge for the partner because they really don't understand what's going on. These are the muscles, we'll go through all the muscles of the pelvic floor and what's happening. And anytime our body experiences pain, the muscles are gonna tighten up as a fear response. So getting your body to relax, we'll teach, soft tissue work, massage, things like that that are very calming for your muscles and your body. So if we feel we need to, connect to a therapist or, other support, then we'll make that recommendation. I like to have things in the room so they're like, no, let me just take that card, or, if you're not comfortable yet saying, a lot of times things come out later after they get to know you, there actually was trauma, but I wasn't comfortable talking about it. So we just really try to make you feel as comfortable as possible and that it's a safe place.
And I would say, when I work with people, patients that come in, my practice, we block off 90 minutes to do a full evaluation. We want to hear your story, know your experiences, know your symptoms, and just to be a little more specific, if there's challenges around intimacy, it can be many things. It could be a nerve thing, it could be a muscle thing, and it can be a tissue thing. And so we know endo is a hormonal, influenced by hormones. And so around the opening of the vagina, it's called your vestibule, there's tons of hormone receptors there. So and once something's uncomfortable, like Britta said, the tissue has memory. It's like if you've been in an accident and you go to that scene, you tense. That's just normal. And so a lot of what we do is the physical work, but it's also helping to retrain your brain and nervous system to not let that fear response dictate, which fear can impact your libido, your arousal, your enjoyment. And so that's what makes it such a complex thing to work with. But there's definitely help, and we can teach strategies. I talk positioning, just like somebody comes in with a back injury, I'm teaching them how do you lift your kid, how are you taking out, doing chores. There are mechanics around sex, and we talk about that, with strategies and stuff too, so, yeah.
And we'll also educate on how, what different kind of lubrication you might want to use, or how to use a dilator, all these things that are so scary to use, or how to insert a tampon. I mean, I know from my experience, I was like, what am I gonna do?
Yeah.
So I just have this vivid memory with a girlfriend trying to figure it all out. But we are a resource for you. So, and if it's not the right time for you, then you can follow us on Instagram, or we do podcasts, we do workshops and things like that. So you can connect with whoever's in your area, and it's just something you can kind of follow and get little tidbits on what's comfortable, but huge on education, and you're not alone with what you're feeling. I've been through it, so I feel like, I can, I know what works, I know what doesn't work, at least for, the conditions that I've had, and it's just nice to have that support that we didn't really have,
Yeah. What challenges might individuals with endometriosis face in accessing pelvic floor therapy, and how can these barriers be addressed?
That's so hard.
Yeah.
I think your location where you live, there's been patients that have come in from Georgia, various locations where they just don't have that resource, or they'll drive in from, various places, because there's really no pelvic floor there. We do offer telehealth, things like that, or like I said, you can go follow social media, to kind of get that, support. But yeah, definitely looking in your area to find who's there.
And I would say a couple barriers, in all honesty. One, there's just not a lot of physical therapists. I've been a PT for 30 years, and it was on the hot growing profession then, and it's still such a scarcity of just physical therapists. And then you take pelvic floor therapists, that's even less, and then someone that treats pelvic pain is even less. So it is hard because there's just not a lot of, thank you. It's just not a lot of us out there. And then another barrier is insurance. And unfortunately, most larger hospital systems, they offer, rehab services, and so many of them may have pelvic floor therapists. And so they're large enough that they can absorb the cost, because if you've ever had PT, a traditional PT, they may have one therapist seeing 3 or 4 people at a time. This is something, I cannot spend 90 minutes and get, hospitals will not pay me to do that because they're not getting money. So insurance is a big thing. That's a barrier, unfortunately.
Yeah. That's a shame too.
It is,
It's a
for
shame.
all women, all conditions, whether, from a chronic illness or other things. And so there's, a lot of therapists are practicing out of network. And so, you have to navigate some of those situations. So, yeah.
And I think to add to that is, a lot of times pelvic PT is not a standard of care. So if you've had any kind of abdominal surgery or any kind of gynecological surgery, you might not automatically be prescribed, unfortunately,
Which is crazy.
pelvic therapy. If you had a knee injury and you had surgery, you're gonna go get PT for that.
Yes.
But pelvic PT just isn't a standard of care. We're advocating for it, but you have to advocate for yourself and speak up. So I tell my patients, tell your doctor. If you wanna, try to get your insurance to pay for it, you will need to get a prescription. And if your therapist is out of network, like we are, then you can at least submit it to get your out of network benefits, but you do have to advocate for yourself often, because it's just not, unfortunately, a standard of care.
Okay, and this is our last question. What innovations or emerging trends in pelvic floor therapy hold promise for improving outcomes for individuals, and what challenges might be addressed to implement these advances effectively?
That was a hard question.
Are there any new techniques, any new?
I will say new techniques that I've been using. I love, my hands obviously are my best tools. But I've gotten into therapeutic cupping. It's very different from static cupping. If you know, Michael Phelps and all these big we don't do that. It feels very comfortable.
What is cupping? I'm sorry.
So cupping is a myofascial technique. I was almost gonna bring them.
Like the suction.
Yeah, they suction. They basically, so you have your skin, your fascia, and then you'll have your muscles. So the cup will sit on yours, it'll actually lift the fascia up off the muscle. So it's very soothing. If you're having a lot of abdominal pain, we can do it on your back. and release that. Or, you know, as you get more comfortable, we can do it over your lower abdominals, over your bladder. If you're having bladder pain, it can really help decrease, or pelvic pain, we can do it over inner thighs. There's just so much that we can do. Or tailbone pain, we can do it over your glutes. Yeah, so that's been a wonderful tool. Graston, I love Graston. It helps with scar tissue.
Okay.
To help decrease, like if you had adhesions from laparoscopic surgery or anything like that. Graston's wonderful as well. We'll do, you know, joint mobilization. Trying to think what other.
I was gonna say, for me personally, I just think pelvic PT is like.
Yeah, well, yeah,
right.
Because
definitely
people
falls
are
in there.
becoming more aware of it, and we're, you know, being a part of more of the team approach, in managing care. In the last year, I've done more specific training around fertility, so that's kind of a newer thing where pelvic PTs are getting more into that. And that meaning, you know, we move scar tissue anywhere in our body. And so often with endo, the inflammation that's there, it breeds fibrosis and scar tissue. So working on the womb space, on the ovaries, on the bladder, like doing more, it's called visceral mobilization. So it's just, we're moving organs just like we can move muscles and other nerves and things. So that is something we've been getting, you know, more into the impact, you know, health and function. And then especially around fertility, where it's trying to naturally conceive or prepare for, you know, assisted techniques that are there. So, and of course the holistic part.
Yeah. So we can help prevent the adhesions from, you know, getting on to the ovaries and the, you know, all the areas that you don't want them to be on.
I think this is great, a great other thing that we can use instead of surgery.
Yes.
And, you know, because a lot of us don't wanna have to go through that, or maybe we've even had surgery, and even still we have symptoms and we don't wanna have to go back through that. So I think this is a great resource, and it's amazing that it's starting to be more prominent, and people are starting to recognize it more. That's awesome. Does anyone have any questions? Yeah, about that is mine.
Bring them
Go ahead, you go first.
Okay, so hello, I'm Hope. As a person who has history with going to PT, I did acupuncture, I did everything through the military, so I don't know if that should tell you something. Cause it's not great help there sometimes. But I'm still trying to figure out if I should do pelvic floor therapy again, because I didn't have any help through the VA. With that, but you're in Northern Virginia, I live in Chantilly, so I'm open to options, but how would you help a patient who has been through therapy with no relief, no anything, to like encourage them to come back to therapy? Because sometimes it's like, oh, I don't even want to do this because this is a waste. And also, this might be crazy, but have you guys like done dry needling for that? Because that's the only, like when I was in PT for my knee, that was the only thing that helped me was dry needling. Like, so I was wondering if y'all could do that also with the pelvic floor area.
There is dry needling for the pelvic floor. I personally haven't done the training, but I'm connected with other providers that I refer to. So if I'm not able to achieve the results I want, or to help the patient, again, that's part of having the team approach with every therapist is their own unique specialty. And personally, I'm sorry that's happened to you. And that's what I was saying earlier. There's a lot of pelvic therapists, but when you guys, just what we spoke earlier about finding the right surgeon, call and ask, like, do you treat pelvic pain? What's your approach? Really do your research, because unfortunately, you can take like a pelvic floor 1 class and then market, I'm a pelvic floor therapist. You are gonna get a whole different experience than like us that's been treating chronic pain and has lots of other specialty training behind. And so, yeah, I'm sorry that happened to you, so. Yes.
Yeah, absolutely. So a lot of places will also offer like a 15-minute free consultation. So at least you can kind of get in with the provider and feel like, how does that feel talking to them? It is not uncommon to go through several doctors. They say it can take years to find the right doctor, or go through medical trauma. I definitely can speak of that, just having pelvic pain, that it took me forever to find the right gynecologist, where I was like, I'm never going to one ever again. And then I found the right one, and I knew like this was my doctor. And that's gonna be the same feeling that you get when you meet one of us, where you're gonna be like, okay, like that, you're yeah. So listen to your instincts. You want to feel that connection. We're just like like going to a therapist. There's a lot that just like aren't the right ones for you, and you just have to feel that connection. And this is definitely one of those situations where you want to feel supported and connected. Yeah, that was great.
Any other questions?
Yeah, go ahead.
Yeah, so, pelvic floor therapy, I've had it before, it was great when I had good insurance,
Yeah.
But like, I feel like pelvic floor therapy is becoming more aware, people are becoming more aware of it. It's even starting to be included like basic training for new doulas, like they're teaching us what to do with our clients and everything with that. But can you speak to more about, let's just say someone doesn't have that insurance for that coverage and doesn't have that opportunity to actually seek out for for PT. What do you suggest what can you suggest for others to do that still they are considering it, but don't really have a way to actually have access to it?
That's a hard question. So I know at my practice we do consultations, and whether you book with me or not, I always try to give resources. And there's a lot of people that do a lot of Googling, but I even try to give them like legitimate sourced things, like this is a good product that you can use to help yourself. Whether it's, certain stretches on, YouTube, or certain books that are vetted by, specialists in the community that I know. But again, hospital-based programs tend to have, more services that are still linked with insurance. I don't know if I answered your question, but.
No, that's a great point with the hospital programs. And for us, where patients are, struggling to, afford, you can kind of space your appointments out. You could also participate in a workshop where, you are kind of sharing that time with other people, but you're gonna get some good information that you can take away, or exercises. Those kind of things can be helpful as well.
And that's a great point, because I have some people of all backgrounds and economic status, and again, after I evaluate them, we come up with a plan together. So, I have a young lady who's in her early 20s with Endo, and she's had excision surgery, she's managing with progesterone, and so I'm we do like once a month. And I've given her many tools to do on a regular, again, education. So, yes.
So we try to work with you, and then, I haven't done it yet, but on my website that is soon to be created, there's blogs, and there's different things that you can kind of click on and find, maybe I can try these. And so we try to be as educational as possible and provide as many resources as we can, give you.
Hello, so I've had 2 excision surgeries now, and I typically do pelvic floor physical therapy after, like you guys talked about doing that as a little tune-up, something to do after your surgery. But what my question is, and what I always struggle with, is how long should I be doing pelvic floor physical therapy? When is the time?
That's a good question.
It's something that costs us money, so how long, when can we stop? Is that a lifelong My doctor tried to explain it to me like it's something that you can always come in for a tune-up, like you were
Right.
saying, the young woman once a month. But right now I told him, I was like, I'm gonna take a break for insurance purposes. But I wanna go back, I just don't know at what frequency, and should this be a forever thing, or, you know.
I think with any chronic condition, you usually have ongoing supports as needed.
Yeah.
So I may work with someone that's in a very acute phase of like symptoms, and they get better, and then they, we start maybe once a week, and then every other week, and then we still, it's less of me, more of them.
Okay.
And then when flare-ups happen, hopefully I've taught them tools to, one, understand what is your trigger. And unfortunately, as women, we usually are feeding, pouring out into so many other parts of life, but really having the knowledge to listen to our body and learn our triggers, whether it's food, whether it's stress, whether it's an activity, and then having tools for that. But then people come back in when there is a flare, and then they go back off again. So I think framing it around, this is a chronic thing, and so just having a team of support that's gonna support the goals, for you.
Yeah, I had a question.
Thank you.
So a little bit of a trigger word, and I'm gonna say it for everybody, because that's a little deep in my question. So I'm all into holistic medicine and all of that. Like you said, our body keeps score of like everything. So all of us in here are dealing with endometriosis. So that's one thing that our body is keeping score down there of the trauma. A lot of us are naturally clenching our vaginas, not even knowing. We're just walking around clenched. So I've done like chiropractic, I do acupuncture, I do a lot of holistic things to help me get better. But my question for you was, how do you navigate caring for patients who have sexual trauma? How do you navigate caring for patients who have like birthing trauma? I don't have kids yet, but I wanted to include that because that's also a very traumatic experience that affects your pelvic floor. So when you have patients who've been through, serious traumas like that, and their body is also holding on to that, how do you navigate that? And also, like, how long does it take to kind of let go of that memory? Like, we can relax now. Like, we're not in fight or flight anymore. How do you navigate those situations?
That is a loaded question. I would say one of the first things that I usually give people to do going home, well, one, I just explained the relationship between your nervous system and your pelvic floor. As you mentioned, our fight or flight system, if a dog is chasing us, if we've had pain or trauma, we can't control our heart rate, or like when tension comes. So those same signals go to your pelvic floor. So like you said, you're walking around in this heightened state, not even aware. So one of the first things I would say is just every hour or two, checking in with your own body. Are your jaws tense? Are your shoulders like your earrings? Are you clenching your stomach? And so now, if that's happening, oh, my pelvic floor is doing that too. So just doing mindful moments of check-in, unclench, and doing really good relaxation breaths. There were studies to show that breathing longer exhales more than inhales. So if you go in and then a very slow, that is so much more effective than like other meditations and things. So that's free. Like listening to so knowing, recognizing when you are tensing. And then number two, what's the situation? Is it a person? Is it a thing? Is it a pain? Or is it the internal things we're telling ourselves that are winding us up too? So I think to me that's just huge, of just connecting with that mind-body awareness. And then in my sessions, I'm not a therapist, but I am trauma informed, and so I always will refer out if that's appropriate. And but I think we have the beauty, I'm talking a lot, I'm sorry.
No, you're
But
Piggyback.
I think because symptoms will bring people to us,
Yeah.
I think it's a perfect opportunity for you to start paying attention and listening every day to your body. You know, just tracking, not just when your period is there, but like every day, what's happening and how am I responding, instead of what happens is disassociation, or we're just powering through and paying attention to everything else, so.
Yeah.
Absolutely.
And we'll encourage you to, you know, take some time, maybe journaling, finding different things that calm your body, because oftentimes you are in this fight or flight. And recognizing that, and, you know, maybe it's a nice bath, maybe it's some music, maybe it's, you know, whatever it is that creates that calmness in your body is what we want to tap into, because we certainly can't, you know, if your body's like this, we have to wait for your body to be okay with it. There's sensate therapy, which a lot of that sensate therapy is basically kind of getting used to just being touched and your body being like, okay, this is okay. And that's where we'll start. So anytime there's trauma involved, that's a huge, it's very important to share that when you're comfortable. We can pick up on the cues, we are trauma informed. But, you know, we wanna make sure, are you okay? And, you know, read your language, and then training whoever, you know, is in your life on how to integrate. It's a process. It may, you know, require reaching out to, like, you know, other therapists. You know, I have a degree in psychology, so I think that's served me well in this profession. But, you know, there's definitely wonderful therapists, there's support groups, that, you know, we can connect you with as well. So we are huge on networking and making sure that you're taken care of, and you are in control, which is nice, to know that, like, this is your body and you get to say what happens, so.
You said we have time for one more?
Oh, that's the last question.
Oh.
It was
Ah.
okay.